Hey everybody, welcome to another exciting episode of Clinic Gym Radio. I, as always, am your host, Dr. Josh Satterlee, and today it is my pleasure to once again welcome the amazing and incredible man with the best haircut in the business, Curt Kippenberger. Curt, how are you, bud?
Doing well, Josh. I have you to thank for my haircut too, so I appreciate you getting Rogaine.
Well, the story that I tell is that you're so smart that your brain got so big it pushed all the hair follicles out of your head. That's why you're bald.
I like that story. I'll stick with that.
Okay, good. Yeah, it's better than the one I think you were going to tell about what I said. So instead of our listeners thinking I'm rude, let's just think you're incredibly smart and everybody wins, right?
I like it.
Sweet. So, Curt, I wanted to have this kind of series of the podcast. We're getting on people all about the success stories, people that have implemented the clinic gym model and enjoy it, love it, fallen in love, or fallen out of love. You, as I understand, have added the hybrid kind of setup in an already successful chiropractic clinic that you had there in Columbia, Missouri. And I want to talk about how it's going. So for everybody's background, can you give them a little snapshot of kind of what your practice is like and where you're at?
Yeah, we've been open 11 years in August, and we started out in a 1,200 square foot facility that offered chiropractic, acupuncture, dry needling, and some massage therapy. And we didn't really even have any room for even traditional rehab. So we would knock down a massage table, or we would move out the coffee table of the reception area, and we would just do rehab wherever we had space because we valued it. We knew our patients needed it. They wanted it. And we would do rehab in a closet. It just didn't matter where we would get it done. We would get it done. And so that was August of 2010. We were thankful enough to scale our practice fairly quickly. And we moved into a larger facility in July of 2012. About doubling our space, 2,500 square feet there. And we had a small 15 by 17 room for rehab. And I think that model worked really, really well. We got a lot of patients well. We had a lot of fun practicing. We were able to hire and farm out some of the rehab with folks of many different disciplines, athletic trainers, massage therapists, personal trainers. I even had an esthetician that was probably one of my most successful CTAs just because she had a ton of manual therapy experience and she was a total gym rat and just loved everything exercise and rehab. And then in 2017, we had an opportunity to add another 1,000 square feet to our clinic. And this is kind of when critical mass was hitting the clinic gym hybrid market. And you and I had talked about it, at SFMA seminars and over the phone, but it was really coming to light with what you did with Biomechanics Las Vegas. And after coming out and seeing your facility, I was really excited to try to emulate that. And so currently we operate out of approximately 3,500 square feet. We have about a 700 square foot gym, and we run small group classes and our cash-based rehab system out of that side of the facility.
Awesome. So you went from a very, traditional floor plan of individual offices in a very cut up space. And you started kind of breaking down some walls and adding on some square footage and everything to kind of expand the gym portion of your clinic while keeping almost everything roughly the same.
Yeah, exactly. And, the cool thing about that process is the clinic did continue to grow. It didn't miss a beat. We went from a single doctor practice to as large as a 5-doctor practice. We host interns constantly and really consider ourselves a true chiropractic teaching clinic. We value not only our undergraduates and master's program interns, but our chiro intern program has really flourished over the years. And I think we've been able to offer the students something very unique as far as their last 4 to 8 month learning experience.
Yeah, I've met a few of the people that have gone through your internship program, and we've talked about some, and I think everybody that goes through your place definitely comes out better for it. It's not always comfortable, but I think it's, you see a demonstration of both. Hey, this has to work as an amazing diagnostic and treatment facility because people come here for pain relief, and also it has to work as a business. And so you can't spend an hour and a half on each patient and collect $20. Like, that just won't keep the lights on and the doors open. So, well, along those lines, Curt, so talking about the business model of it, what I want to do in this interview, maybe dive into the business successes of the clinic gym hybrid blend, then maybe the clinical successes, and then maybe talk about, I don't want to, mislead everybody that, hey, it's nothing to worry about. There's no speed bumps, but let's talk about some of the warts and speed bumps and tough parts as well. And by that time, we should be at the end of our drinks and be ready to wrap it up. So
there's never an end of the drink, Josh. It's just the next one.
I guess that's true. Yeah, if you've really planned out well and stocked your liquor cabinet, there's no end to the drinks. So it was funny. I went to the doctor the other day, and she, the nurse is doing intake on me or whatever, and she's like, "Do you drink?" And I said, "Yes." And she said, "Do you drink?" And I said, "Yeah." She said, "How often?" I said, "As often as I can, but life keeps getting in the way." And she laughed a little bit. She's like, "So what, 2 or 3 days a week?" I was like, "I try for 7, but everything seems to get in the way." And so, yeah, probably 2 or 3 days a week.
Nobody likes a quitter either, Josh. So you
no,
keep
that's
that
right.
Up. Yeah. I'll be a bandwagon.
Yeah. So when you started out, and I know you've kind of been, we've had phone calls and video calls along the way. You and I have kind of walked a similar path. You came down to the super conference in Austin, Texas with one trainer that ended up not being the long-term trainer, but very nice person, very smart.
And did a great job for us. Yeah.
Yeah. Let's go back before it all started. What did you think was going to happen when you started adding the gym?
So it's kind of funny. When we started this remodel process, which was laborious in itself, I remember meeting with the contractor and the architects. And like I said, our existing space was adjacent to what we absorbed. And we were a very busy 3-doctor practice at that time. So construction was a little terrifying because I knew that we were going to have to shut down certain parts of the clinic. And there was one time that we were operating out of that 2,500 square feet, and we literally took everything out of the front, all of our clinical treatment rooms, our rehab space, our front desk space, and we shoved it into 2 12 by 12 rooms, 7 by 14 rooms, and our bathrooms. And so literally people were coming in our back door, checking in the hallway during our bathroom. We had one evaluation room. It was just a cluster. It was unbelievable. But, honestly, we continued to grow through that time. And I was really, really shocked. So, maybe bullet point number 1 on the business type of successes is our systems were strong enough to sustain a 7-month construction project that was supposed to only take 12 weeks. And that really kind of set the tone of what we needed to create for the gym. And so now we had this space, we had a commodity that I knew would be popular. We had worked with a lot of studio personal training gyms over the years, and we were very successful in integrating care with fitness, but we just wanted it under one roof. And I remember coming to my 2 chiropractic therapy assistants at the time, Natalie and Milo, and I was like, all right, we've got an ATC and we've got an esthetician that is, just an absolute gym rat. This should thrive. And I kind of just handed it off to him like, all right, go forth and be successful. Here's an FMS test kit. Let's see what happens. And it was terrible. Don't get me wrong. They had fun. We had some patients that, went through their program, and it was okay. We were undercharging. We didn't have a single system in place. And I remember calling you one night. It was late here. It was probably like 8. And I was sitting in the gym and I was like, man, I built this damn thing and nothing's happening. And you called me out, which is great. And you're just like, hey man, like your chiro business has got all these systems. What systems do you have for the gym? And right around that time, we were transitioning into having our new trainer, Christy, come on board. And you had this idea of the super conference in Austin. I was like, great. Can I bring my trainer? And you're like, oh shit, I didn't think about that. Yeah, bring her. Like, that'd be great. And so she was the only trainer there, which was awesome. I think that she felt like, not special. That's kind of very pretentious, but she felt very valued. She thought that that was a cool thing. The fact that we were able to come down and learn how to create some systems, which you and Dan Leonard, that's when the light clicked, was the super conference. It was like, okay, we make fitness a part of the care plan, not just a part of the building. And we came home, we rewrote our day 1 and day 2 systems, and then all of our patient experience systems. And I would say from that day forward, we scaled the gym, not necessarily super fast, but we scaled it a hell of a lot better than what we were doing previously. And we identified some obstacles, we identified some hurdles along the way. And that process took, about a year to get under our feet. And things were gelling pretty well. I think the gym at that point was probably producing close to $4,000 a month. And at that time in our practice, that was probably somewhere around 7% of our monthly revenue. And I was pretty happy with that. My trainer was almost paying for herself. We were delivering fantastic care. Patients were getting better outcomes and just having an overall more fun experience. And then my trainer gave her notice, and I was like, crap, she was perfect. And
she had kind of built the system. I mean, she had been there since day one, like hacking it out of solid stone, right? Like, hey, let's create this, and this. So it was almost like you're losing 50% of the core of the business. But I want to go back real quick, because you mentioned one thing that I just want people to hear too. You said it was super fun. People loved it. How much enjoyment, and it's hard to quantify, but how much more enjoyment did you feel once you got a gym in your facility? So not doing rehab, but I'm saying like people actually doing like pull-ups, deadlifts, squats with weight, like sweating profusely for more than half an hour. How much did that change the feeling in the office?
I think our gym's kind of unique. It's very visible. We have these big, gigantic windows. They're 8 or 9 foot by 9 foot square. It blends into our reception area, blends into our waiting area. So you can't miss what's going on in the gym. And I did that purposefully. I wanted people to say, hey, what the hell is going on over there? Not only the patients participating in the program, not only our staff, our team, who are seeing these people just, like you said, doing things that they might not have seen themselves capable of doing, deadlifting their body weight, deadlifting 2 times their body weight. But what I thought was really cool is that chatter started happening in the reception area, and we started getting questions at the front desk like, hey, what's that over there? I want to do that. And so we started getting organic referrals just from our clinic that these people were under maintenance care. I may have been seeing them for 4 or 5 years at whatever interval they found appropriate to see me. And then they're inquiring about fitness. And I think that's when we saw the opportunity. There's actually a campaign that we're going to run here over the summer. Do you want more out of your manipulation? Because we have a large maintenance base of practice after 11 years. And when you really buy into the principles of the SFMA and the functional movement systems, we do a fantastic reset in the office. We give them these amazing tools at home to reinforce what we did clinically. But the reloading and the retraining strategy, even today, I have a woman who's, she's 60. She's very, very unhealthy. She's got lots of comorbidities. She's teeny, 110 pounds. And she was like, I've never been to a place like this where I get my chiropractic treatment. You guys gave me home exercises, and then you make me go work for it in the gym. And literally that phrase coming out of her mouth, I was like, holy crap, man, if you're 60, frail, and completely dissociated with anything in the physical rehabilitation model and or performance model, and you get it, why doesn't everybody get it? And I think everybody can get it.
That's awesome. So it's much more enjoyable for both the patients and the providers and anybody just sitting in the waiting room. I think that's one hard thing to explain is, I'm sure you've had those days in the clinic where it's just a slog, Curt, and you're just like, dude, I'm getting through this. I love what I do, but my God, today is hard.
Oh,
When
yeah.
you come in and you see people high-fiving, sweating, smiling in the gym, man, it makes a lot of that toughness disappear. It's just,
Right. And occasionally you'll hear somebody just scream, woo! And they just PR'd on something, or they got their first pull up, or,
a loud thud and then a woo is awesome.
Yeah.
And, it's always, it permeates the psyche of everybody. So you're telling us a story. So everything was rocking and rolling. You had built your systems, you got it going. You came to the super conference and everything was just jamming. I know you guys had both been through the CFSC because we kind of joined that up with that first super conference. And then the person that built it and helped you create everything puts in her notice.
Yeah.
And take us through what happened after that.
So we're kind of fortunate. We had a few players that we were able to put in that position. One of them is my cousin, and she actually covered a few classes for Christy when she was either ill or out on vacation. I can't remember which. We also had another provider that was part-time, and she ended up taking most of the reins for the gym and covering all of Christy's group classes. And Kyler did a fantastic job as well. I mean, she really cultivated the patient base. And the nice thing was she was able to really relate that clinical integration to some of their activities. And let me just
clean some stuff up here for the listeners. So Christy was the trainer that helped you kind of build everything, right?
Correct.
And she was a trainer by certification. She had been training at other gyms. She actually had owned a gym in the past, right? If I remember correctly.
Yep.
Yeah. Now, she was the one that put in her notice after you'd got this thing. I mean, the wheels were turning, so that's good, right? So she built this thing. She helped you. She built a bunch of systems. And then I can remember the phone call of, hey, she put in her notice. What should I be looking for somebody else, right? Like, do I need to only look at trainers, or what should I be looking for? And we had a conversation. I remember this, like, about you're looking for a skill set of customer service is what you're looking for. So everybody listening, please don't base your hiring of that CA or trainer off of what certifications they have or don't have. Base it off of how much you like to be around them and how much your patients like to be around them and people like to be around them. And if you like to be around them a lot, you can turn that person into a trainer, but the opposite doesn't seem to hold true.
Absolutely. Yeah. No, you're exactly right. We always say hire personality first. And then I would say with the chiro side, you do have to have a little bit of, you got to have a lot of skill actually to thrive in our practice and a lot of practices that are associated with the clinic gym hybrid model. But still, like, that can be built. It can be taught. They just have to have a good foundation and the bandwidth to be adaptable and coachable. But yeah, the level of empathy and the level of just patient communication, emotional intelligence, you can't replace that with any of the other facets. I don't care how good of a diagnostician, how good of a chiropractor, how good of a trainer you are. If you are socially inept and cannot communicate with people, it'll be impossibly successful.
I love it. Yeah. And we have a course called Hiring the Perfect Trainer, and it's all about, like, just go for the freaking customer service skills. So if you're looking for a step-by-step method, check out our website, clinicgymhybrid.com, and look in the courses section. And it's all about hiring a trainer, because we've seen this go on so many times. All right. So you hire somebody and you get it rolling. What was the high watermark of so you said before it made $4,000 a month with Christy, that was 7% of total revenue. What's the best it's ever done business-wise in relation to the clinic?
So our current trainer, Amy, who we hired literally 3 weeks after shutdown, stay at home, whatever you want to call it, she took the reins from Dr. Kyler, and obviously had a little slow time there in the early stages of 2020. And once June kind of hit, and granted, we had to alter a lot of things. We shrank our classes down to sets of 2, and masks and social distancing and all those other things had to be in play. But the nice thing about being in a healthcare facility is we were able to keep the gym kind of churning. And Amy
essential, not just for oils,
Well, and I'll tell you what, I mean, my wife loves essential oils and I think they smell nice, but yeah, like, why isn't fitness considered essential. I think the healthy people did really, better than the unhealthy. And that's a whole other topic of discussion. But anyway, Amy maintained, she maintained those kind of desperate months. And we started seeing her climb up towards, the summer fall junction. And then we hit a little holiday lull. And I'm really happy to say, the last 3 months, she's had record month over record month. And she's just up over $6,000 monthly in revenue. And now she's at 10% of our monthly revenue. So she's killing it. And I think, again, we've got better systems, more robust training, not only for our clients, but for our team. And the cool thing is, there's a dirty word in healthcare business, which is sales, right? Like, nobody likes the word sales. You're not selling anything. You're solving a problem, right? Like, the problem is you can't lift a laundry basket off the floor without having back pain. So let's prove it to yourself that you can lift a, 55-pound kettlebell off the ground. I don't think, unless you've got like a towel or a basket full of towels from the pool, I don't think we're going to even come close to touching 55 pounds. And so we always want to make people more durable and more resilient. And I think when people feel that, see that, and then apply that at home, that's where the magic happens.
Yeah, that's awesome. And there's nothing better than, I think, to counteract the durability idea or the fragility idea. There's nothing better when a patient comes in and says like, oh, I can't do XYZ. And then you can point at, hey, see Mr. Johnson over there 6 weeks ago, he couldn't do XYZ. And now look at him, and they go, oh, really? And you're like, yeah, and he's way older than you or weaker than you or smaller than you or whatever, and it's just like, oh, well, all right, I guess you guys know what you're doing here. They kind of breaks that. Like, you can tell the patient all day long, but that doesn't mean they actually believe it. Right.
One of Amy's first organic clients was a referral from one of our allied health professionals here in town. And, she at the time was 77, very, fit otherwise, but she had a pretty rough knee. She's got medial compartment syndrome, lots of joint collapse, a lot of knee pain associated with that. I saw her through the clinic for 7 or 8 visits. And I looked at this individual and I was like, you know what? I really think we need to build some resiliency, some durability. And one of the things that this provider had told her is like, avoid squatting. And she was really nervous to squat. And I looked this woman in the face. I was like, well, what's the first thing you do in the morning when you get up? Go to the bathroom. That's a squat. So at the very least, we've got to be able to do a body weight squat comfortably without pain. And she still sees Amy 2 times a week. It's unbelievable what this woman's been able to recapture in her lifestyle. She loves walking, and she was walking 3 to 5 miles a day prior to her knee really kind of going down the dumps. And I'm not saying she's doing it pain-free a year and a half later, but she's doing it again. She was kind of relinquished to about a mile. And the stuff that I see her and Amy working on is pretty unfathomable, given what I know about this woman 18 months ago and to what I see her today. And that, I got to be honest with you, you go back to what joys does the clinic gym model bring? It's seeing people take back their lives and maybe redefining it to a certain degree. She maybe had some fear avoidance with a lot of movements, and she's not barbell back squatting her body weight by any means, but she's sure doing some goblet squats now with a kettlebell, which is pretty neat.
One thing that you're reminding of for my listeners out there, one thing that's really important that Curt brought up is, sales, and you got to sell this program to everybody or advise everybody to exercise. Because one thing that is 100% true of all of my clients is every one of them has a handful of people that they never expected to say yes to a membership. It's the unlikely person, the person, like you're saying, 65-year-old woman that essentially has never been a member of a gym in her entire life and has multiple comorbidities. I can think of one of my clients, and he has a husband-wife combo that are both diagnosed with stenosis, which they wouldn't say is inappropriate diagnosis, but they're the mindset of like, you can label me, but I won't, I don't necessarily have to agree with it. And they join the gym and they're loving it. They flourish. They come every day. And I told them, hey man, you should have 3 times a week memberships and that's it. And these people he sold them unlimited and they're like maxing that out. He said there are literally days one week they came 5 days a week and twice 2 of those days. But excuse me, you just never know who's going to sign up. You just never do. And a lot of times the opposite is true too. Do you think there's people, that's guaranteed Kurt's going to sign up, guaranteed. And I don't know. I already go to a gym and stuff. And so I would say offer it to everybody, especially the membership. You'll be shocked at how many people take you up on it.
We always say, don't ever pre-qualify a patient, whether that's for a treatment plan or add-ons or whatever. Like, put your clinical hat on, recommend what you would recommend to anybody, whether it's the richest man in the world or the most impoverished person in the world. Tell them with empathy that you're going to work your ass off to get them as well as they can in, the shortest amount of time frame. And I mean, fitness really is the foundation of health, right? I mean, we were just talking about if we had more fit people, we would be more resilient, whether it's to anything. And I think that we're seeing the shift now. I mean, especially with things like you're doing with Clinic Gym and just people being more empowered with information that fitness will be kind of the foundation, the pyramid. And, and I always tell people, I'll see you as many times as you want to see me, but we want to deliver the minimum therapeutic dose for the maximum therapeutic effect. And the best way to do that is to get your butt in that gym and become more durable.
Yeah. I've said this quote many times, but it's my favorite Mark Ripito quote is, strong people are harder to kill and more useful in general.
Yeah, I've been avoiding that specific quote, but yeah, we use that interchangeably with some of our other studio gyms in town because more resilient, durable, harder to kill. It's all the same thing. And that's it doesn't matter if you have 2 daughters like me that I want to be harder to kill because they're going to have some boyfriends that I want to hit later or what, but it is what it is.
Yeah, or like, hey, what if there's a zombie apocalypse? You never know. Like, you ever watch those movies? It's rarely the twiggy little dude that survives, So
never double tap, right?
That's right. Yeah. So from a business perspective, this has been a marked improvement. Let's talk about clinical. Like, what are some of the high points clinically that you notice have really improved by incorporating a gym?
So I really wish that when I ran into one of my classmates back in 2012 that we would have jumped on the chiro bandwagon early, because we would have had all of this data to like really tell you exact numbers. But I know over the years, and I can look back at our statistics, I can tell you that in 2021 versus 2012, I'm probably recommending somewhere along the lines of 4 to 6 less visits clinically, meaning seeing me and doing, passive care, chiropractic manipulation, soft tissue, dry needling, instrument, whatever. Primarily because of the way that we've incorporated our rehab in the last 4 years. I think that even when we weren't doing fitness well, we were still offering people really meaningful rehab and meaningful fitness opportunities outside of our office. Now, I mean, literally after your first day, so we have our new patient experience looks a little something like, SFMA, MDT, whatever we need to do to get a good clinical picture. And then at the end of the day, we do a clinical audit and we teach them to pressurize or centralize. So use their diaphragm to breathe, create some core stability, or try to take the radicular symptoms away. Day 2 is a report of their clinical findings, functional and clinical diagnoses, their home exercise program, a slightly more holistic treatment, but we still always do that clinical audit because that's important. We got to build value, prove value, and then show value long-term, right? Then day 3 and beyond, it's fitness. It's not banded external rotations anymore. If you have something going on with your shoulder, we're going to find your impairment level that we can work with within the 4x4 matrix. And then we're moving through that, and we're doing it under load almost every time. We very rarely do not load our patients from day 2 and beyond. And the entire goal is once they get to see Amy, whatever that is, at visit 4, 6, 8, we want them to be ready to do at least a 4-2. So they should be able to stand and at least demonstrate the movement on their own free will. Ideally a 4-4. We want to see them resisted and moving by the time we get them to her. So I think that, not only utilizing these different systems. So long story short, it's shortened our treatment program or our treatment plans. It has increased the amount of time that we see people in between for regular maintenance care. And I would say the bell curve of our population still sees us every 4 to 6 weeks. But now we're seeing people push that out to quarterly, every 2 months, sometimes every 6 months. And the majority of those folks are either working with us or working with one of the gyms that we trust in town.
I love it. It's, it's funny. As you were talking, I was thinking, the way it started for me is really, if you take the SFMA and the FMS, you can't get away from having the ability to exercise or whatever you want to call it, rehab or something. You need open space to do that, whether it's rolling patterns and rows and pull-ups and, basic stuff like that. Like, you can't not have a gym. I just don't know how these clinics with, where it's all individual offices, bam, next to each other, or it's the big open adjusting bay with 6 tables in it. I'm like, what do you do? Like, do you just send people off and not, you should rehab, but you don't do it?
Right.
So I hope everybody listening here, we call it the clinic gym hybrid, but really just having some open space is all you need. Like, when I say gym, it's not a bunch of equipment bolted to the floor. It's open space with some free weights, kettlebells, dumbbells, whatever you got. I mean, hell, sandbags would work. Backpacks full of old books would work. It doesn't matter. It's just something that has some weight.
Yeah. And I think the other deal too is everybody is so cost conscious. Like, when I opened, and I know when you opened, because I've seen your facility, we didn't hold back. Like, we spent a lot of money in build out. We spent a lot of money in equipment, and don't get me wrong, that's cool. It creates a very cool environment, but you don't need anything. You need a, couple hundred square feet. You need,
Dude, I swear to God, almost every client I have, like 30 to 50% too much on equipment.
Right.
Like, we had a bunch of 10-pound dumbbell sets that we're just never going to use, and just collected dust and held the floor down, and so many patients I know, I can think of one that has has a squat rack. He has 3 of them. The third one just gets used sparingly, if at all. It's really a storage area, and it's kind of the inside of it is like where they store some vertical stuff. And I'm like thinking, man, that's $1,500, $2,000 worth of equipment. Like, what are we doing here? Almost everybody I know has too much crap, So, yeah. All right. Well, we're a little tight on time, so I want to kind of hit the fast forward button. But for those people listening that are like, man, I dig on this, let me ask you this question. This is total self-promotion here, but you purchased one of our programs, you went through it. You also came to the super conference. How valuable was that information?
I mean, it was a game changer as far as being able to see through this brick wall of, I have a very successful chiropractic clinic. Systems should just fall into place because we've created so many of them for this. And then, I mean, literally, I want to say it's like page 16. I've looked at it so many damn times out of that super clinic binder. It just says, build fitness into your treatment plan. And it was that simple. Like, that gear was worth the cost of the weekend, the travel, taking an extra person, hands down, like a no-brainer. And don't get me wrong, it wasn't as simple as that, because we did have a lot of systems and I could see through that, but I just needed that little key to unlock the door. For those of you who don't have systems, I mean, that's the easiest way to do it. I think you're trying to bring this conference back to Parker, correct? And is it September?
It got delayed a little bit. Yeah, but we're trying to host another conference.
I mean, I'll plug you shamelessly. Like, that clinic or that conference specifically was one of the most influential for the rehab side of our practice. And honestly, I mean, if you really want to look at it holistically, it's obviously taken better care of our patients too. I mean, we're saving them money on the clinical side of things. We're saving some of their insurance dollars for, other stuff that they might have go on. And we're transferring them into a monthly program that is going to literally change their lives. I mean, it's a no-brainer. Yeah. I think the super conference was one of the most fun. And Austin, was a fun town. I think
Yeah.
Parker and Dallas is fun too. So I'll be there, so long as it's a weekend that I don't have some family obligation, I'll be there for sure.
Awesome. So moving on from that, I mean, basically what you said is buy our stuff, use our systems, use our processes, use our conferences, which I hope everybody took that to heart. And, I mean, that's really why we do this. But all joking aside, I'm being sarcastic there. Like, I try and put this together because I just think this is the best setup for a clinic in the world. Like, it's more fun, more profitable, easier, systematic, and the patients get this incredible care. And I know it probably sounds like I'm just trying to pimp our processes and our systems and everything, but I truly believe that.
Right.
But let's talk about this. It's not without fault. It's not without difficulty. It's not without stumbling blocks. So what were your top 2 stumbling blocks you encountered along the journey?
Initially it was the vision of.
Interesting. I never would have guessed that would be the answer.
Well, the vision, not in the way of patient care and rehab, but when I look at 1,500 square foot of space, I divide it in 10 by 10 rooms, and I look at how much revenue I could generate with chiropractic full of that room. Because that's been our primary revenue generator for 11 years, or, at least prior to 2018, it was our primary revenue generator. And, currently the way that our model is chiropractic still more profitable? I don't know. I mean, I'd have to break down what the salary, what the benefits, what the continuing education that we pay for, all those other things, and then subtract that off of what that square footage is. I'm going to guess it's pretty darn close to even. And so then I look at a new space, if I'm a new grad or a doc that's wanting to open their own business, or somebody who's just wanting to do another location, and how much money I can save and build out by not building all those walls in that 1,500 square foot space, then generating the same revenue. That seems like a pretty profitable revenue cycle to me.
Yeah. I mean, I always tell people, like, you can run a clinic by moving tables into a gym. Like, you can have a totally open space that you can train people in, put tables out. Now you have a clinic, right? And it sounds insane, but like having curtains to divide the spaces up. Like, I had that in my student clinic and it sucked. I thought it sucked. And now I look back and go, that was genius, because it's a good use of open space.
Right.
So you can do that, but you cannot do the opposite. You cannot have 10 by 10 rooms and go, we're going to build a gym inside these 3 rooms. It just doesn't work that way. It's too broken up, right? So if you're trying to keep costs down and also build a better business model, I think keep as much open space as you can.
Right. You can always add a wall. I've helped a lot of the members of the Clinic Gym Hybrid group design their space. And, initially, one of my buddies, Steve Sherman, did a really great job with his space. He built 2 rooms, which I think is smart. I don't care if you're a single provider or you've got 3 providers. I think having 2 private rooms is probably a safe bet. And then the rest should be open and modular. Even if you have to have a wall between your reception area, put it on wheels or do a curtain or the fold away things. I mean, your space is your most equitable thing. And by the way, I mean, Josh and I have had this conversation many times, but when you're not in the clinic, your clinic can make you money. So the more open the space, the better, because people will rent that space for a premium. Hotels are expensive. Conference rooms are expensive. You can get a pretty decent deal. I mean, Southwest sells all of their empty space on their airlines to FedEx because they're already going to Washington. They may as well take your packages, and they're making money off their empty storage. So I think that having that open model is really important. If I look back at that first clinic that we built, we had 1,200 square feet. Like I said, it was very square. By the way, square spaces are really hard unless they're really big. So look for more rectangular spaces. Just
long rectangles are the best.
Pro tip.
All things being equal.
Yeah. But I would have rearranged that completely different. I could have had the backside completely open, and then a treatment room on one side, a treatment room on the other, a little reception in the front, and just running back and forth, and then between the gym. Like, I see that vision through my head all the time. Same thing with the current space that we have. I love the feel and the vibe of our practice. I'm about 94% happy with it. And I think that if/when we decide to change that model, that my next one will certainly trump what I have now. That's one. Let's see, vision. And then what's the other one?
What about the cost of getting it started, or what you had to kind of give up in clinical income to do it? Or was there anything where it kind of changed the dynamic?
You get really fortunate because I had some really turnkey players for trainers. I think that could be something, and we've seen this on the board. I think Andy's had some issues with getting a trainer in there and keeping them engaged to their first 2 hours of employment, because everybody's like a hummingbird, wants to go to the next bit of nectar. But honestly, if you can source the talent, which I think can be a crux, but again, hire personality before training. This last cycle, so I got to brag on my current trainer, Brandon. He's absolutely killing it. He's been a personal trainer for a while. He's got some great certs. But the other thing Brandon has, Brandon and I would have been pretty close to best friends in high school, I'm guessing. He's just got a great personality. He's sarcastic. He gives people shit. They give it back to him. And it's just a lot of fun. And he's really good at working around people's impairments and giving them the bandwidth to fail, but then teaching them why they failed, rather than just saying, hey, activate this, do this. Can you drop your shoulder blade? Can you engage this glute? Can you get your foot tripod? And he's not hovering over like a freaking lawnmower helicopter parent. He's giving people the ability to move and kind of find their movement. So anyway, I just wanted to say he's doing a great job. But on the flip side of that, we hired his personality. We did not hire him because he was in an SDA CPT. We didn't hire him because he had this experience with a group previously in Columbia that we really respected. We didn't hire him for those reasons. Those are cool resume boosters, but we hired him because he sent me a video of teaching me how to play a fret on his guitar as part of his interview process, which, by the way, Josh, thank you. That's been one of our most valuable pieces of interview skill set acquisitions. So
that's deep within the accelerator program, right?
That's very deep. That's like module 17 of 43. Yeah.
I'm glad you got value out of it.
I did. So, aside from space, talent acquisition, I think being okay with being low tech. All of us want to have squat racks and Ultra G treadmills and all these rogue bikes. Those are neat. Those are cool. You can get that anywhere. You can go to any CrossFit box in the United States and you can get that. What you can't get is somebody who really, really knows their stuff, which they're going to learn a ton from you being a DC, a PT, ATC, whoever is running the gym or the business itself. They're going to get a ton from the continuing education that you're going to help them out with, or at least direct them towards through FMS, CFSC. We could go on and on about the list of good stuff. And I think just being okay with having some bands, some sliders, a few kettlebells.
Well, if you remember at the super conference, we gave you a full workout kit, right? Which was slider, band, mini band, and I can't remember what else we included. But the whole idea was that, what's that?
There was a bag. It was nice to hold everything in there.
That's right. Just like Crown Royal, right? You got to have that nice velvet sack. But the whole idea was,
I'm a bourbon guy.
the overarching idea was we're in a tiny conference room with 15 people, and we wanted to show hey, in this small space with this minimal equipment that you can literally carry, smaller than a backpack, in a woman's clutch, we can still give you a good workout. Oh, a tennis ball. There was a tennis ball in there too. And
foam roller. I think you guys said. No. The foam rollers are optional, I think. Okay. But regardless, and Brandon smoked us all in 20 minutes. I don't even think it was a 40-minute workout. It was 20 minutes, and everybody's glutes were on fire. Everybody's, I think, foot was on fire because he had us doing some kind of weird low lunge hold. It was awesome. It was, eye-opening. Especially, one of the things actually I do want to digress on, chiropractors treat everybody like they're complete movement morons, and they shouldn't. So very protective, right? The general chiropractic population is, don't go run, don't go do this, don't do that. Trainers are the opposite, right? They're go do everything until you can't do it anymore. And one of the synergies that I really appreciate about the bond that the clinic gym hybrid model portrays is we get to meet in the middle and really have cognizant discussions about how we can make this person better. And who was it? I had a patient today that said that there was something that their physician said that they should never do again. And I was like, well, do you want to do it? Like, does it bring you a ton of value? Let's weigh the pros and cons. Is this literally going to destroy your knee? Or is it going to create a challenge that you need perfect mobility and stability in every other joint to get your knee to be able to achieve this? And I think that's where we get to kind of be the guide, the Alfred of Batman, so to speak, of taking our patients through this experience, because it's super easy to have a hip replacement and say, hey, Josh, just never do triathlons again and you'll be fine. That's the exact reason you had the damn thing repaired in the first place, right? Like, you want to go out and do those things. Even if you can't run, could you do an aqua bike? Hell yeah. I mean, that's totally hip sparing. So people lack creativity in their advice of daily living these days. I think it's too easy to be restrictive versus proactive.
Yeah, that's a good point. So Curt, if you could go back and, start it all over again, would you start with a gym? Would you start with a clinic? Would you start with a clinic gym hybrid? What would you do? There you are graduating. Where'd you go again? Logan? You graduated Logan in 1902 or whatever.
Yeah. Back when I had a beard, just like D.D. Palmer did, which been close, but not quite that good. I would unanimously have a gym. My first 3 patients were a pro mountain biker, a pro triathlete, and just a pretty good runner, like let's say an elite amateur runner. And I saw them in the basement of the house that Chris and I were renting before we even opened the gym. I did have my license. I will digress. I did have my license. But I look back at all of those impairments. So the mountain biker couldn't ride any longer than 3 hours, which he was a marathon mountain bike racer. And so those are 4, 5, 6 hours long without like debilitating low back pain, SI pain. My triathlete had a crazy hip flexor issue, and my runners are all jacked up anyway, so they had everything. But
mostly in the head, but oftentimes physically as well.
Runner's neurosis is a real thing. But long story short, I was a personal trainer and an athletic trainer before I went to school. I had a huge skill set that I could have delivered to them in the comfort of my own basement had I had, maybe just the insight, the wherewithal, and the vision to treat them from that standpoint. But I was a chiropractor and I was going to treat them chiropractic. And by the way, we got good results. I ended up co-managing the mountain biker. He got an injection in his SI. Everything was great. The triathlete went on to do some really cool stuff. The runner went on to do some really cool stuff. But I mean, my patients from day one were saying, hey, we want this model. And I didn't have it. And so then I created a generic space for my psychographic. I was involved in cycling my entire life. I still am. And I didn't create a space for me. I didn't create a space for them. That was stupid. I created a medical space that I thought was akin to being a chiropractor. And then I'm out doing rehab in our lobby. That doesn't make sense. I want to do rehab. Why did I have a gym or an area, a PT bay, whatever you want to call it? So finally, when we moved to the second space, I was like, cool, I made it. I've got 15 by 15 to do whatever I want. And by the way, I could have done a lot more in that 15 by 15 square foot space. I know Josh has got clients that have killed it in 120 square foot or less with fitness, with small group classes, and with recurring membership. So that's fantastic. I didn't have it though. And then by the time I met Josh in 2012 at my first SFMA seminar, and then I went out to see Biomechanics Las Vegas, I believe in 2014, that's when everything clicked. And I was like, okay, had we met, 4 years prior, I would have started here. And actually I wouldn't have started with Biomechanics Las Vegas because I think you had showers and you said no showers, right?
Worst investment of my entire life. I really appreciate you spending time with us today and kind of going over this. What's the best way to get a hold of you if people have questions or they want to see the model in person, or maybe a student wants to intern with you?
Right. So you can go to www.focusonhealthchiro.com, or you can reach out to me directly over email at drcurt@focusonhealthchiro.com. We'd love to have you out, whether you're a student or wanting to shadow, wanting to intern. Right now, we're placing our interns in the middle of 2022, I believe. And we'd love to have those discussions. I mean, whether you want to look at a position in Columbia, Missouri, or whether you want to be teamed up with somebody that we trust, or somebody that you just want to come learn from and then go open your own. Like we kind of have an open door policy as far as that's concerned.
Too kind, baby. Too kind. So, all right. Well, Curt, I really appreciate the time today, and I hope people do reach out and check out your place. You're a great example of the success, and that's what we want to capture in this podcast. So I want to say thank you. And on behalf of Curt Kippenberger, this is Dr. Josh Satterlee saying, go out there, maximize your license, and live the life you dream of, just like Curt. Thanks a lot, Curt.
Yeah, appreciate you having us. Appreciate it,
man. Thanks so much for checking out these videos. I hope they're useful. We'll cover things like rehab, exercise, business model, progressions, layout, everything else that helps you build a clinic. So if you're interested, you can click here, there, here, or anywhere to get more videos just like this. Thanks a lot for watching, and we'll see you soon.